In this video, we will be discussing environmental racism and its impact on epidemics. To start with, what is environmental racism? According to Beech, environmental racism is a form of systemic racism whereby communities of color are disproportionately burdened with health hazards through policies and practices that force them to live in proximity to sources of toxic waste, such as sewage works, mines, landfills, power stations, major roads, and emitters of airborne particulate matter. This idea can also be expanded to the concept of people in the global south shouldering the majority of the burden of climate change, while wealthier nations are the main contributors in the first place. The health issues caused by environmental racism are significant in contributing to the spread of viral illnesses and play a major role in epidemics and pandemics. The concept of environmental racism began in the U.S. when it was found that race played a major role in environmentally caused health disparities, beyond the associations between race and socioeconomic status alone. In fact, it was found that Black Americans making $50,000 to $60,000 a year were more likely to live in polluted areas than their white counterparts making $10,000, and Black children are exposed to up to 30% more air pollution than white children, according to Beech. A major example of environmental racism in the U.S. is which communities tend to be closer to hazardous waste dumping sites. According to Beech, African American children were 5 times more likely to have lead poisoning from proximity to waste than Caucasian children. Communities with high percentages of people of color tend to be closer to hazardous waste sites because, according to Milano, so-called dirty industries and governments met with much less resistance to putting facilities and roads in neighborhoods where residents were not part of the decision-making process and often lacked resources to effectively fight the moves. Communities of color also tend to live closer to hydraulic fracturing sites. According to Suarez, in Texas, hydraulic fracturing wells are more than twice as common in areas with over 80% BIPOC populations. Levels of exposure to airborne volatile organic compounds, such as benzene and chloroform, have been found to be 52% and 37% higher for Mexican Americans and non-Hispanic Black people, respectively, than non-Hispanic white people, even after adjusting for socioeconomic factors. Lead poisoning is also historically a huge issue for people of color in the U.S., with the case of Flint, Michigan being a notable example. According to Waitskin and colleagues, Flint, Michigan is a majority Black city that experienced high lead levels in their water due to a change in their city's water supply. This was ultimately allowed in the first place because government officials felt that the citizens could not fight the change, and the slow response once the lead contamination was suspected involved the government tampering with water testing protocol to artificially lower lead levels on tests to convince the citizens that there was no problem, where in fact there was. The effects of the high lead levels in the water resulted in many different health issues for Flint residents, including learning disabilities and birth defects. Another example of communities of color experiencing negligence by government officials in ensuring the safety of their environments was in Baltimore, Maryland, where many majority Black communities experienced lead poisoning through the paint in their homes. According to McCoy, Saul E. Kerpelman, a Baltimore lawyer who said he had litigated more than 4,000 lead poisoning lawsuits over 3 decades, reported that nearly 99.9% of his clientele was Black, illustrating the disparity in who is affected by lead poisoning the most in this country. Lead poisoning is so dangerous because of its drastic health consequences, while being near fracking and hazardous waste sites also have significant impact on health. When combined with viral illnesses, the health complications that ensue result in people of color being worstly affected. On a global scale, environmental racism can be seen in how many wealthy nations treat the global south as waste dumping sites due to weaker safety laws. According to Beech, more than 44 million tons of e-waste was generated globally in 2017, 6 kilograms for every person on the planet, and of that, each year around 80% is exported to Asia. The exportation of waste from countries with larger white populations to the global south highlights the systemic devaluation of the health of people of color. The global south also bears the majority of the effects of global warming and climate change, although the main contributors to climate change are wealthier nations, who are able to avoid much of the consequences of their own carbon footprint. According to Bush and colleagues, in particular, tropical regions will experience significant changes in human pathogen relationships because of climate change. Changing temperatures and precipitation patterns linked to climate change will further affect health by changing the ecology of various vector-borne diseases, such as malaria, dengue, chikungunya, Japanese encephalitis, Kala-azar, and filariasis. Mosquitoes are a major carrier of disease, and according to Assad and Carpenter, it has been predicted that global warming will expand the mosquito vector ranges beyond the tropics. This will result in an increased spread of mosquito-borne diseases among the global south. The effects of air pollution on COVID-19 is obvious, with sufferers of severe air pollution being at a much greater risk of dying both from COVID-19 and from the more ordinary burdens of lung cancers, emphysema, and heart diseases they developed as a result of all that noxious air, according to Mason. In some cities of the global south, air pollution, much of which comes from wealthier parts of the globe, exceeds the levels of New York City by 500%, which has a devastating effect on respiratory health, which can in turn become a death sentence in a respiratory illness-related pandemic, according to Mason. According to the OECD, air pollution can increase susceptibility to acute respiratory illnesses like COVID-19 and accounts for 4.2 million deaths annually, and 17% of deaths from acute respiratory illnesses, including COVID. According to Bagley, higher levels of air pollution were linked to an 8% rise in the COVID-19 death rate. Here are my references, and thank you for listening to my video.